Start by washing your hands, greeting the patient and gaining consent, ensuring a chaperone is present. Expose the patient below the waist, keeping their underwear on. Ensure that the patient is not in any pain and begin inspection. Look for any varicose veins, describing any varicosities as for any other lump. Remembering varicosities above the knee are related to the long saphenous vein, whereas those that are below the knee may be related to the long or short saphenous veins. Examine the skin, particularly the gaiter area, looking for venous eczema, hemosiderin deposition or lipodermatosclerosis. Look for edema, which may be secondary to a DVT, and look for ulcers, particularly over the malleoli. Also look for scars indicative of previous surgery. Move on to palpation, comparing each side. We will demonstrate the remainder of this examination on the right side only. Begin by palpating for a saphena varix. Palpate over the saphenofemoral junction. This lies 4 cm below and lateral to the pubic tubercle and is a smooth, soft bluish swelling that disappears on lying down. You may then proceed to the cough or tap test, palpating any varicosities distally and tap them proximally or ask the patient to cough. A transmitted impulse distally suggests incompetent proximal valves. You may then move on to Trendelenburg test. Lie the patient down and empty any veins by milking them proximally. Put pressure over the saphenofemoral junction and ask the patient to stand. If this achieves control, then there is possible saphenofemoral junction incompetence. If control is not achieved, locate the level of incompetence by moving on to the Tourniquet test. Once again, lie the patient down and empty any varicosities by milking them proximally. Place a tourniquet proximally around the thigh and then ask the patient to stand up. If control is achieved, then the level of incompetence is either at or above the tourniquet level. If control is not achieved, the level of incompetence is below the tourniquet level. To isolate this, repeat the procedure by moving the tourniquet distally until control is achieved. Once control is achieved, you may move on to Perthes test. With the tourniquet still on the limb, ask the patient to stand up and down on their tiptoes. If the varicosities reappear or the patient experiences pain in the leg, this suggests an incompetent deep venous system. You may then remove the tourniquet and move on to the handheld doppler test, which we shall demonstrate on the left leg. With the patient standing, place the doppler over the sapheno-popliteal junction. Squeeze the calf and listen for a doppler sound. One whoosh with an abrupt cutoff suggests a competent valve. If this is followed by a second whoosh, an incompetent valve is present. You should repeat this at the saphenofemoral junction. You may complete your examination by auscultating for femoral bruits, performing a full abdominal examination including PR, calculate the ABPI and order appropriate investigations. Thank the patient and help them dress. Start by washing your hands, introduce yourself to the patient and gain consent. Ensure a chaperone is present and the patient is exposed and positioned appropriately. Measure the systolic pressure in the patient's brachial artery using a sphygmomanometer and handheld doppler. This is achieved by inflating the cuff until the doppler signal disappears. Then, slowly deflate the cuff until the signal reappears again. The pressure is recorded at this point. Now measure the systolic pressure in the patient's dorsalis pedis and posterior tibial arteries. We will demonstrate this at the posterior tibial artery. Again, inflate the cuff until the signal disappears, then slowly deflate the cuff until the signal reappears again. Again, record the pressure at this point. To calculate the ABPI, divide the ankle systolic pressure by the brachial systolic pressure. The ankle pressure is the higher systolic value of either the dorsalis pedis or posterior tibial arteries. This should be repeated for the contralateral limbs. A normal ABPI is 1. Complete your examination by thanking the patient and helping them dress.